dealing with the new Omicron variant that is pervasive now within our community. Delta is still here as well, and we're going to share with you the details today. But I felt that it was important that we communicate with our community what our plan of action is. And so that's what I want our Orange County residents to hear today, that we have a plan of action to make certain that we continue to be responsive to the emerging trends that we're seeing with COVID-19 within our community. So as we move forward today, I want to just share with you that we want our community to be resolute and to really continue to do those things to stop the spread of the virus. While it is evident that the Omicron variant may not be quite as infectious or impactful as the Delta variant or other, it can still make you sick, and you can give it to someone else who may have more significant consequences if they contracted the disease. So let us all just continue to do our part. That's what I'm asking from all of you today, is to do your part. Do your part to help stop the transmission within our community. According to an NBC News analysis of state and local health data, COVID-19 cases in Florida jumped 744% in the past 2 weeks. That is extraordinary. Florida was only surpassed by Washington, D.C., which saw a 902% increase in cases. Florida also ranks third in the United States in total cases, 4.3 million cases within Florida. Some 62,000+ individuals have died in our state of the coronavirus. The infectious disease director, Ms. Alvina Shu, is here from the Florida Department of Health in Orange County to shed more light on the numbers that we are seeing currently within our county. Orange County school children returned to the classroom today after the winter break. 4 of my grandchildren are in the Orange County Public Schools, and I can't wait to hear from Dr. Jenkins, who just joined us, as she will give you an update about the plan of action from our school district here. We also have Mr. Ed Torres, our utilities director, who is here, who will provide an update about Orange County's wastewater surveillance that is underway. Perhaps that is the precursor to what we can expect within the coming days and weeks here within Orange County. And there will be some additional news that we'll share with Comptroller Diamond, who is here to talk about our overall economic health here within Orange County and how it relates to our tourism numbers. Here are the latest numbers from the Department of Health that was shared with me earlier about Orange County's experience. There are now some 280,564 coronavirus cases reported in Orange County. If each one of those cases represented a unique individual, that would mean that 20% of Orange County's 1.4 million population would have contracted the disease at this point. But we can't purely look at it that way, because some people have tested positive, and some people who are testing positive in our county perhaps are not our Orange County residents. They're supposed to be. But it is a good indication that roughly means 1 in 5 people who are being tested are testing positive in our community. However, when we look at the daily numbers, we know that our 14-day positivity rate has now increased to 30.27% in Orange County. Nearly 1 in 3 persons who have tested in the last 14 days has tested positive for the virus. I know there was a report today, Steve Hudak and the Orlando Sentinel, that said as of January the 2nd, in a report, 35% of Orange County's population had tested positive. That was a daily testing rate that was reported in the Sentinel today. A lot of people have died, nearly 2,300 people in our county alone now has died of COVID-19. The exact number that was given to me is 2,299, so nearly 2,300. That's a startling number to me. And the goal that we have in mind is to really stop any future deaths from occurring within our community. That will not be the reality if we don't all work together and do what we can. When we put that number into perspective, the 14-day positivity rate has doubled within the last 1 week. The percentage of residents 5 years of age and older who have had one or more shots of the vaccine is 74%. That number is going up very slowly at this point, but it is increasing. We still are having these press events to encourage our residents, adults, and those eligible children who can get vaccinated. Please go get vaccinated. As for testing, demand is still high, as I talked about earlier. Currently, our health services workers are operating 3 testing sites, and on January 2nd and 3rd, they administered a combined total of nearly 10,000 just between our 3 sites. Dr. Yolanda Martinez, our health services director, is here today should any questions come up about our specific efforts underway as Orange County government. We cannot stress enough the importance of isolating if you test positive. You know, I know that there may be an urge to just want to continue your normal or regular activities if you test positive. Don't do it. Stay home, isolate, stay away from the other people. Isolate away from your family. Barnett Park's line closed today at 2:30 because of the overwhelming demand from people who wanted to know their status. The line was quite lengthy. The other 2 sites are the Econ Soccer Complex and the South Orlando Youth Complex. The line at each site opens daily at 9 a.m. and workers ask that if you want to ensure that you can get a free test, to be in line by 7 a.m. If you need more information, we ask you to go to our website at ocfl.net/testing. The mobile trailer continues to move throughout the community. In fact, as we speak today, the trailer is at the John H. Jackson Neighborhood Center in the Paramore area of the downtown Orlando area. Tomorrow, it will be at the Mexican Consulate on Technology Drive out near John Young and West Colonial Drive. It will be there between the hours of 9 a.m. until noon. If you can't make it to the vaccine trailer, there are plenty of free doses of COVID-19 vaccine at Barnett Park. On the weekends, the children's Pfizer vaccine is available. Appointments are recommended for children ages 5 to 11, and a legal guardian must be present with the child. Barnett Park is open again between the hours of 9 a.m. and 5 p.m. 7 days a week, unless we obviously have to close early. As the media has been reporting, the lines are very long, and there's really only one way into the park. Vaccines there are being administered at various Orange County public schools, as well as federal retail pharmacies, the VA Orlando Healthcare Center, and other community sites as well. You can get information about where the vaccine is offered by going to the website ocfl.net/vaccine sites, or you can go to vaccines.gov. And the mask mandate remains in effect at this point for Orange County employees. We are not exempt from the rapid spread of the Omicron variant, and we're doing everything that we can to not shut our workforce down. As public servants, we're here to make certain that we continue to serve our community during the good and the bad times. And I hate to tell you that I'm concerned about the impact that the current spread is having on our workforce in general here within Central Florida. Because obviously good, responsible employers do not want their employees who are positive to come to work and spread it to other employees or spread it to their customers or their guests. So if we're not careful, as the rate of transmission obviously is picking up, we could find ourselves adversely impacting the overall workforce here within Central Florida. Here in Orange County, we have 254 employees who are isolating with positive COVID test results. 59 are from our corrections department. They work at our jail. 53 are from our fire rescue department, and another 49 individuals work within our utilities department. So Orange County employees will be wearing masks for the foreseeable future unless they have some medical or other exemption. And so I'm going to pass it on at this point to Ms. Alvina Shue from the Florida Department of Health at Orange County. And Ms. Shue, you're recognized, and then we'll move forward.
Thank you, Mr. Mayor. As Mayor Demings had previously mentioned, we've had a total of 280,564 cases reported to us here in Orange County residents. Our 14-day rolling percent positivity average is 30.27%. The last time we spoke at the last news conference, the percent positivity was 14.60. So as the mayor had mentioned, we've doubled in the last week. Our 7-day average incidence rate, and I'll remind you of the CDC's definitions for the transmission levels for when we move into high transmission within the community is 100 or greater cases per 100,000 population, and with a percent positivity of greater than 10%. And so our 7-day average incidence rate now is 1,823.1. At the last news conference, our 7-day incidence rate was 788.2. Unfortunately, we've had 2,299 deaths reported to us since the last time we spoke, and we send our condolences to the families and friends. The new cases in the past 2 weeks continue to predominantly be in the age group of 25 to 34 years of age. Most recently, this is 20% of all cases that have been reported to us. As we mentioned at the last news conference, the Omicron variant, the B11529, and its lineages, the BA lineages, have been verified in Orange County resident cases through genome sequencing. However, currently the Delta variant continues to be the dominant variant circulating within our community. With the concurrent increase in cases, there's been a concurrent increase in hospitalizations. So what we've seen is an increase in time very sharply of adult and pediatric hospitalizations. And from the information that we've had about the Omicron variant, it's not necessarily that the variant causes more severe disease, but the volume of cases causes a proportional increase in these hospitalizations. And this is what we're seeing reflected. And this comes from our hospitalization data, which is from routine contact tracing and surveillance. The mayor had mentioned about the vaccinations. So we're encouraged that for those 65 years and older have received, 90% of those have received at least one dose of vaccine. And those 5 years and older, so those persons who are eligible to receive any COVID-19 vaccine who have received at least one dose is 74% in Orange County. And with that, I'll turn it over to Dr. Barbara Jenkins from the Orange County Public Schools.
Thank you and good afternoon. Let me start by thanking our mayor, Mayor Demings, again for his outstanding leadership for our community and for inviting me to speak. Today we began the second semester, in case you hadn't heard, for 206,000 students back on school campuses. It helps to remind the public of just how large Orange County Public Schools really are, ranked 8th or 9th in the nation. I want to cover 6 brief topics for you. First of all, concerning COVID masks. As you know, this weekend, we encouraged our employees who were about to return to work to wear face masks due to the highly contagious Omicron variant. At the time, county data indicated a fairly low percentage of actual positive cases identified as our employees and students. Clearly, those numbers continued to grow. I want to mention, critical to our decision and our deliberation yesterday was a severe increase in sick leave call-ins from our school staff. Not necessarily identifying as COVID-19 illness, but teachers feeling a need to call in sick. So over the weekend, we grew from about 171. Our average after a holiday is around 250 or so. We grew to 391, and by noon yesterday, we were up to 434. It was time for some additional action. So yesterday, after further consultation with Dr. Hsu, Dr. Pino, certainly as I spoke to board members, it was out of an abundance of caution for our employees and students that I determined face masks will be mandatory for all adults in OCPS buildings and vehicles while in the presence of others during the school day. We believe this will help, as the mayor mentioned, help preserve our workforce and keep our schools open. Mask requirement is in effect until the end of January, at which time we will reassess the needs. Now remember, state law prohibits, I still get emails on this, I want to remind everyone, state law prohibits requiring face masks for our students. However, we do strongly encourage and have strongly encouraged that parents consider it because of the highly contagious nature of this new variant. Let me mention something about the dashboard. We continue to monitor cases in the district, and we work closely with the Florida Department of Health in Orange County. The district COVID-19 dashboard is up and running again after winter break. First update took place at midnight last night and will subsequently be updated each evening at about midnight. In fact, it's 11:59 that it's coded to update. They will continue daily. The cases displayed on the dashboard for today and tomorrow will mostly reflect the two-week winter break. We are getting caught up on that data that was provided to us, so you will see the large jumps in numbers. At last check, it was 866 students and 309 employees. Many of those cases have likely recovered and are able to be back in school or at work. Concerning student learning, I know it is disappointing to some, but I have to reiterate, we are not allowed to move students back to digital learning, at-home instruction, if you will, based on state restrictions. We are not allowed to make that move. As mentioned earlier, the district experienced significant numbers of call-ins, sick leave by school-based staff. An estimated 5% of our instructional staff called in sick. Out of nearly 14,000 teachers, that would be about 700. Principals had plans in place to make sure classes were covered by staff as well as substitutes, and we had a good beginning to our first day back. Now, a few parents have been asking about whether or not they could keep their child home out of their own need for caution due to the rise in COVID-19 cases. I want to be very clear. We do not encourage parents to keep their children home. We prefer that they would be in school, but it's a parent's prerogative. If they decide they want to keep their child home for health and safety reasons, we can certainly not prohibit it. Parents would be responsible to reach out to their child's teacher to gather information about missing assignments, just as they would for any other absence. Got tonsillitis, you have the flu, whatever the case may be, teachers are accustomed to parents reaching out if their child has to be at home to communicate regarding missing assignments. Parents may also decide that they prefer to homeschool their children for the rest of the semester, even if they so decide. That is an option provided to parents. They just need to contact our school choice office to make us aware of that. Experts currently expect that the latest increase in COVID-19 cases will peak soon, so hopefully we will see a decrease in parental concerns as well. Transportation would ask for patience from our parents who depend on our school buses to transport children to and from school. There will be some delays because we have absences among our bus drivers as well. Nearly a 650-member force had about 92 absences, call-ins today. So we would ask for patience. We will get those students transported as expeditiously as possible. Want to mention something about our safety protocols. We will continue to practice our COVID-19 protocols, such as sanitizing, hand washing, and limited social distancing when possible. If our schools are 100% in attendance, we know we can't have the kind of social distancing some might hope for, but as much as possible. We are also hopeful that some testing provisions will be available soon in partnership with FDOH at Orange County. The district, need to be clear on this as well because I get emails, the district is not able to secure testing kits on our own. It is most critical, and I heard the mayor say this earlier as well, I want to reiterate it, the most critical weapon we have is for students and employees to please remain at home. If you feel sick, if you feel symptomatic, we want you to err on the side of caution and remain at home. Even if you can't get a test right away, if you feel sick, have any symptoms, please remain at home. And speaking of greatest weapons, I certainly would be remiss not to mention vaccinations. Orange County is happy to provide vaccination sites again. They will resume tomorrow. Clinics will be at Timber Creek High School from 4 until 8 p.m. on Wednesday, January 5th, and on Thursday, January 6th at Windermere High School from 4 to 8 p.m. Next week, we will have more events and locations scheduled. Just go to the OCPS website and look at the COVID-19 information graphic for more details. And finally, the school board and I want to certainly thank all of our amazing teachers, our support staff, our principals and administrators, and families for their dedication in helping us kick off the second semester of our school year. We remain committed to leading our students to success. And with that, I'll hand it over to Comptroller Diamond.
Thank you, Dr. Jenkins. Good afternoon, everybody. I'd like to wish everybody a happy and healthy new year. I hope this is the year that we can finally quit talking about COVID. So with that said, our November Tdt collections were $25,051,900. In comparison to last year, it was a very nice increase. It was an increase of about 183%, so it almost doubled over last year. Also, compared to last month, October, they went up about $3.6 million, so a very nice increase over October. And compared to November 2019, which is the year and the time period that we talk about as being the last strong TDT period, it almost matched November 2019. It came within $700,000. So it was strong. It was a very good November. It was the second best November in the history of the TDT. So a very good November, and we were all very glad to see it. So while that was welcome news, however, we do have to realize that the Omicron variant's recent rise is an unfortunate reminder that uncertainty and challenges lie ahead with the pandemic. As the pandemic and as the COVID numbers increase, I can guarantee you that TDT numbers will decrease. When people up north see cold weather up there, when they see bad weather, they want to come to Florida. But when they see rising COVID numbers, when they see that Florida is the leading state in the country as far as COVID infections, they're going to cancel their trips. I talked to a friend Friday, in fact, who told me that her convention this week was canceled as a result of the COVID spread. On the TDT reserve side, we're very happy to say that there was a $2.1 million increase in reserves last month. That's exactly what we were hoping to see, was more and more increases in reserves. And I would also remind you that there's about a 2-month time lag between the time of the receipts and the time that it goes through the system and you see it. So the nice increase in November's numbers will show up in about a couple of months. On a cumulative basis, since the start of the pandemic, we have used about $133 million of reserves to fill the gap from tourist tax collection losses and meet our TDT obligations. and that has caused our undesignated reserves to drop from $181 million to about $48 million since the beginning of the pandemic. And finally, we will release our December Tdt collection information sometime in early February, and when we get to the question and answer period, I'm more than happy to take any questions you may have. So thank you.
All right, I'm going to ask Ed Torres from our Utilities Department to come up and just share with you what we're seeing with our wastewater surveillance that is underway, and because I believe that it is a good indicator of perhaps where we will be in just a few days or weeks.
Thank you, Mayor Demings, and good afternoon, everyone. As we continue to monitor the SARS-CoV-2 on the wastewater, those RNA concentrations that we have been updating you every so often, the latest results have again spiked in all 3 service areas within Orange County, with yet another set of record high concentrations. If you recall, before the Christmas holiday, in December 20th, we had concentrations in the 500 to 600,000 gene copies of the virus per liter. Before the Christmas holidays, a little bit later, 3 days later, the 23rd, we saw record high concentrations in the 3.2 million range. After Christmas, on December 27th, we saw concentrations with yet another record high of 8.2 million gene copies of the virus per liter. And now, just before the New Year's Eve date, back in December 30th, we saw concentrations as high as 13.8 million gene copies of the virus. We have never recorded anything this high. These numbers, of course, are reflecting infections right here in our community. So this wave of infections that we're seeing now, again, is not over yet, and we have to continue to do what we can to stop that spread of the virus. Both when we look at the variants within the wastewater, not clinical cases, but within the wastewater, we're both seeing the Omicron and the Delta variants circulating within our community, with the Omicron variant being the prevalent one, again, in the wastewater. The results from that December 30th sample, again, just before New Year's Eve, we saw between 96 to 98% of the wastewater having Omicron, being the Omicron variant. In the past, we have referred as our last few variants as being hyper-transmissible, and I can tell you Omicron has far redefined that concept, becoming so dominant, at least on the wastewater side, in just a matter of a week and a half or so, with these record high concentrations. So again, these are before the New Year's Eve holiday, these concentrations, and before those gatherings. So we expect concentrations to increase some more, unfortunately, just prior to the school opening. And as it has been said today by the mayor and others, we really urge our community to get vaccinated and take all the precautions that they need to take to ensure that this doesn't spread any further. Thank you.
I think the takeaway from what Ed is saying here is that COVID is everywhere in our community. But it does not mean that we ought to go out and drink a COVID concoction to ensure that you get COVID. No, as a community, we need to resist COVID. One way to do that is to get vaccinated. Another is to wear the facial coverings. For those who have been vaccinated, all of the experts are saying that if you are fully vaccinated with your booster, the chances are you will have some mild symptoms. But if you are not fully vaccinated and have not had your booster, then it's a crapshoot. You're not certain what your fate may be if you contract COVID. So we're going to stay vigilant in this community to make certain that we do everything that we can. Given everything that you heard, we know that the number of people who are going to contract COVID is going to increase. What we don't know is how sick they will be. I hope and pray that they're not so sick that they have to be hospitalized, that they're not so sick that they have to miss school or miss work, that they're not so sick that they will transmit it to an unsuspecting individual. So this is where we are. At this point, I'm going to also acknowledge Commissioner Myra Uribe joined us here this afternoon, and we have Ms. Ilia Torres who joined us, who can translate if there are any questions in Spanish. We will have her come up to assist in that process. And then, of course, Dr. Yolanda Martinez from Orange County Health Services. She's fluent in Spanish as well. We also have Mr. Mark Tester, our Convention Center Executive Director, who has joined us. I hear from Comptroller Diamond a bit of good news about where we are with the tourist development tax revenues in this community during the month of November. That's a good report. Given my observations about December is going to be a good month for us as well in terms of the tourist development tax revenues. Yes, we are open for business. We have been for the last year and a half, but we've at the same time tried to ensure that we continue to manage the pandemic, the crisis that is before us today. With the help of everyone in our community, we did some things at our convention center to make certain that conventioners who were coming here were able to gather safely. None of us thought or knew that we would be dealing with the current surge that we see today. So my hope is that we will eventually get our hands around the present circumstances that we're living with. And we'll open it up for any questions at this time. And I also forgot, we have Division Chief Laura Lee Avery from the fire department, who is here, our emergency manager as well. And by the way, someone asked earlier if we had made any requests of the state for additional at-home testing kits, and we have put in a request to receive some 100,000 testing kits. We'll see if we get them from the state. If we do, we will develop a pod system where we will very quickly redistribute those at-home testing kits to our residents here because of the overwhelming demand that we see for wanting to know your status. So stand by. We'll see if the state responds and assists us in that process. Okay, we'll open it up for any questions at this time. There will be a microphone that's somewhere in the room going around. Okay, Steve, who that?
Steve Houdet from the Orlando Sentinel. Wow, those are staggering numbers, all of them. I'm not exactly sure even where to begin. Let me start with you, though, Mr. Mayor. Kind of a two-part question. Number one, have you thought about enacting an emergency order again for like you had last year? And secondly, with the absences in the workforce here and also the schools, are you hearing anything from our business community about whether people aren't showing up to work because they're sick, and how is that affecting?
To answer your question, have I thought about a local emergency order? A lot has happened since we first issued emergency orders here in this county. Of course, new state laws have been enacted. A special session just ended in November that significantly reduce the ability of local governments to pivot and make some emergency decisions to deal with the spread of the virus. So I don't want to put, at this time, an emergency order in place that essentially is toothless. I don't believe that that's the right thing to do at this point. But notwithstanding that, the reason why here we are today doing this press briefing that was unscheduled is to make certain that we communicate to our community that even if you don't see us, we are still working on your behalf to keep every one of our residents safe in this community. And we're going to continue to do that, to make the adjustments that's necessary and work, with all levels of government in this response effort.
And Nick Papantonis, WFTV, question for you, Mr. Mayor. What do you make of the governor's plan to continue pursuing monoclonal antibody therapies as his primary response to this surge, especially in light of the fact that lab reports suggest that the two products he's pursuing in particular are less effective against Omicron?
Well, I think that we have to have a multi-pronged approach to approaching the current crisis that is before us. And with any crisis, there comes some planning that has to be done. You have to have a plan of action. And part of that plan of action should entail prevention. We should be doing things to prevent us from having to intervene or respond to the crisis because of an uptick in numbers, a new surge, et cetera. And the way that we can prevent that, obviously, is by encouraging more people to get vaccinated and to social distance and to do all the things that we've talked about. The science is clear there. So in terms of the monoclonal therapy, generally speaking, that is a response to people who have already been exposed, who perhaps have already contracted the virus. And I don't think that, while we certainly don't want people to die or become more critically ill, it is part of the response. That should not be the response to it. It has to be a much broader, more comprehensive response in order to have the kind of desired outcomes that we want. And that is to contain the virus, to get to the point where we are at that 5% or below level within our community where people are not continuing to get sick or die from the virus. That's where we're headed. So that is what I am focused on. With my staff, we have a very capable staff, well-experienced staff. Now, the many months now we have been dealing with COVID. One thing I can tell you about the staff here at Orange County, we've gotten pretty good at what we do when we have compliance and people who will listen, learn from our experience, and take the advice that we are giving them. Okay.
Right here, Emilio Ramos with Telemundo. For the mayor and maybe for the Department of Health. First question is...
Come on up, Ilya.
Oh, she's going to translate? Okay.
If you're going to ask it in Spanish, we'll have her translate.
I'll ask in English, and if she wants to translate, that's fine.
Okay.
Okay, well, the first question has to do with, after you called Governor DeSantis out last week, he came out and explained why he was, according to many, missing in action. How do you react to what he said? And is there a problem with the communication between the county and the state in regards with the resources that the county needs to work with this emergency? And I was going to ask as well, what is the precise situation with the hospitals, if we can provide some specific numbers on hospitalizations and folks in ICU with COVID?
So that's a lot for Ilya to regurgitate back precisely, but I know she'll do the best job, and then I'll respond.
You want me to translate that into Spanish? Sure. Con relación a la reacción de la oficina del gobernador sobre los comentarios que se hicieron la semana pasada, una pregunta sobre eso, si hay algún problema de comunicación con el Estado con relación a los recursos necesarios que necesitamos para operar los centros de prueba y la situación actual sobre los hospitales.
Okay, so to respond kind of globally to the question you asked,
Para responder de forma global a las preguntas que has realizado,
I'm going to say what I'm going to say.
voy a decir lo que van a escuchar.
I think that when you are in a leadership role, particularly as an elected official, you have a role and responsibility to look out for your family, but also look out for the people, the constituents that you represent.
Pienso que cuando estás en una posición de liderazgo, particularmente como oficial electo, no tan solo tienes una responsabilidad para con tu familia, sino para con los constituyentes.
That's what the people do. They elect us to lead.
Las personas nos eligen para liderar.
The fundamental reason that government exists is to keep the people safe.
La razón primordial por la que existe el gobierno es para mantener a las personas de forma segura.
I continue to do so just like I have for the last 41 years.
Yo continúo realizando esa labor tal como lo he hecho por los pasados 41 años.
And yes, there are times when our families may be ill and we have to take care of our families.
Ciertamente hay temporadas en las que nuestros familiares puedan estar enfermos y tengamos que cuidar de ellos.
However, I do believe that you can do both. You can take care of your family, take care of your extended family, the people.
Aún así, pienso que se pueden realizar cumplir con ambas responsabilidades. Puedes cuidar de tu familia y también cuidar de la familia extendida, las personas.
You will not ever hear me make excuses about the demand for my time.
Nunca me van a escuchar ofrecer excusas sobre las demandas para ocupar mi tiempo,
Because I take very seriously my role and my responsibility in my leadership position.
porque tomo con mucha responsabilidad mi rol y mi liderazgo y las responsabilidades que ello conlleva.
And so during this holiday season, just like everyone else, we live through some things.
En esta temporada navideña, como cualquier otra familia, también experimentamos dificultades.
I've had to live through, within the last few weeks, the death of a family member,
En las pasadas semanas experimenté la pérdida de un familiar,
the hospitalization of my 99-year-old father,
la hospitalización de mi padre de 99 años,
family members who have contracted COVID.
miembros de la familia que han contraído el virus.
But I continue to come to work to make sure that we had a plan of action here in Orange County.
Pero yo me continúo presentando al trabajo para asegurar de que tengamos un plan de acción aquí en el condado de Orange.
We have a plan of action to take care of the residents of Orange County.
Tenemos un plan de acción para cuidar de los residentes del condado.
And we take care of those residents regardless of their political affiliation.
Y cuidamos de nuestros residentes sin importar su afiliación política.
So my previous comments, while some may have interpreted them as being overly critical,
Con relación a mis comentarios, a pesar de que fueron interpretados como de forma crítica,
my comments have been to elicit a response.
mis comentarios van dirigidos a provocar una respuesta
to assist me in my leadership role
para que me asistan a mí en el rol de líder o como líder
in taking care of the people here in this community.
en cuidar de las personas que viven aquí en nuestra comunidad.
To be most effective, that means that we must work with all levels of government.
Para ser más efectivo debemos trabajar juntos todos los niveles de gobierno.
I reiterate
Y
that
reitero
that there was a missing middle in the equation of taking care of the people here in this community.
Mayor, may you repeat?
There was a missing middle of the state in the equation of taking care of the people here
Hubo
in this community.
una laguna por parte del Estado en responder a las personas aquí en esta comunidad.
So was there a problem with the communication between the state and the county? Absolutely. Not just between the state and the county, but between the state and the people.
Que si hubo un problema de comunicación entre el Estado y el condado, ciertamente, pero además de eso hubo un problema de comunicación entre el Estado y las personas.
You, the media, if we had asked you a week ago, tell me what's the state's plan for dealing with the overwhelming demand for testing and the surge of COVID-19 throughout the state of Florida, would you have been able to tell me what that plan is or was?
Si yo le hubiera preguntado a los medios la pasada semana cuál era el plan del Estado para responder a la demanda a la demanda para recibir las pruebas y al alza en los casos de COVID, ¿ustedes me pudieran haber dado esa respuesta?
I came here a week ago to make certain that our community knew what we were doing here. And yes, I called some people out to hold them accountable.
Hace una semana me presenté aquí para dejarles saber a nuestra comunidad lo que estábamos haciendo y sí, hice algunos señalamientos para hacer responsables a ciertas personas.
In my role as mayor of Orange County, I am going to continue to be held accountable and to hold others accountable when they should be leading and they are not.
En mi rol como alcalde del condado continuaré comprometido y siendo responsable y de la misma forma haré lo propio con otros que están llamados a liderar.
So now, I hope that you understood what I said. I said what I said.
Espero que hayan entendido lo que dije y sí dije lo que dije.
All right, thank you for the question.
Okay,
Next question.
back here, Melissa Thomas with Florida National News. Okay, earlier today, there was, the governor had a press conference in Jacksonville. Prior to the press conference being able to happen at all, one of the protesters was removed for expressing his opinion. Wanted to find out from you, A, do you think that was a good course of action? It was an older gentleman, part of the more vulnerable population. He was arrested and removed. But then also, what would your course of action be should there be someone in the audience that disagrees with a policy that you're stating in terms of your plan for COVID-19 action?
Is that question for me? Let me just say this. Yeah, I spent nearly 40 years as a law enforcement officer, and I made a number of arrests to cause a number of people to be arrested. I don't know all the facts associated with that, so I can't begin to say whether the arrest was appropriate or not. What I can tell you is that during my long career, there were times where I protected the rights of people who were protesting and making statements about various things from the Klan to others that I did not agree with, but I protected their right to peacefully protest and to demonstrate. So I don't know if the gentleman was peaceful today or not. In his commentary, there's probably not many Board of County Commission meetings that are held where I don't have someone who disagrees with me, but as long as they are peacefully demonstrating and allowing the business of the government to move forward, so be it.
Eric Mock, Spectrum News 13. Question for Dr. Jenkins, actually. I know you said principals, have had plans in place for this, but with 700 teachers out, I mean, are there enough subs to cover all these classrooms? Or are you having to combine some classrooms? Or are some students having to meet in the gym or cafeteria? What ways is the district coping with such a shortage?
Yeah, we've had principals planning since this weekend to make sure they had coverage. We have a service, an organization called Kelly Services that provide the majority of our substitutes. All principals would need to be concerned with are the overages beyond those that were coverable. So on each campus, there are resource teachers, there are individuals who are certified but work outside of the classroom. And for the most part, those individuals were reassigned inside of classrooms to make sure that we had coverage. We have no reports of gyms needing to be used. You would still need the teachers if that were the case. We have no such reports at this hour. All of our attendance information will come forward shortly. I will tell you, we know some folks kept their students at home, which probably was beneficial in instances where more teachers were out in particular schools.
One more, Dr. Jenkins. Asher Wellman, Channel 13. Has the school district, are you guys receiving funds, federal funds for COVID-19, specifically testing? And if you can, why or why not?
We don't have specific funds designated for testing. Our ESSER funds that are coming through are for various measures that we have to put in place to recover student learning loss and to have certain safety protocols in place. We don't have access to actually purchasing our own testing. We depend on other governmental entities for the test kits. In the past, Dr. Pino and Florida Department of Health at Orange County did give us several home testing kits. In December, we distributed many of those to our parents and to employees who were interested in having those. We just need another supply.
Amanda Dukes from Channel 2. This question is for Dr. Hsu. If I heard you correctly, I believe you said that the Delta variant is the dominant variant right now, but then what we're hearing from wastewater is clearly we're seeing Omicron. So in layman's terms, can you explain that disparity?
So there's some inherent delay in the amount of genomic surveillance that when that information comes to us. The wastewater testing is a leading indicator, and so sometimes we see what's in the wastewater appearing later on in what we can detect in case patient samples. So that's the basic gist of it. So as far as the proportions of what we're seeing, it's still predominantly Delta right now. We expect that Omicron is very contagious, and we expect that it will catch up or be dominant as it is across many other places in the United States. I did want to make a point previously about the 90% of the newest cases over the past week have been in unvaccinated persons. So this pandemic continues to be propelled by persons who are unvaccinated, and these are people who are get their first infection and also people who are unvaccinated and get reinfected, so continuously reinfected. And so this pandemic, one of the greatest prevention measures that we can do is to encourage people to get vaccinated, their primary vaccines, and to also complete their series and get boosters. Thank you.
Troy Campbell with Channel 6, and this is for you, Superintendent Jenkins. You kind of touched on it with the bus drivers calling out other staff members as well. We've heard from some parents a little discouraged that their kids didn't get picked up. Parents have other responsibilities to do in the day. You kind of already asked for their patience. So how would you overall assess that issue currently with bus drivers?
So 92 sick call-ins is about 14% of our over 600 drivers. And so I would encourage parents to have alternative plans, partnering with neighbors and individuals, carpooling, with face masks on, I would recommend, but carpooling and having alternative plans. We will get to students. It's just in some instances, that driver has to make one run to the school and then make a second run back to pick up more students, so it's going to be delayed. The communication system that we have in place includes call-outs to parents in individual communities when there is a delay, but I can't promise you that's always going to be in advance enough notice for individuals to make other plans. I encourage parents to have plans for this week and next week as well, to have some alternative plans. So when they get those messages, they know which neighbor is going to make that run to get the children to school. And if at all possible, walking, bike riding, carpooling, any of those alternative ways to get children to school is going to be helpful to us. And I want to stress, I don't mean to indicate, nor should anyone assume that we think there's somehow a lack of dedication of these individuals. We want them to call in sick. If they have any symptoms, we need them to call in sick. We just need help with some alternative measures to be put in place.
Hey, Mayor, how you doing? Mike Kirby from Channel 2. Due to the increasing demands at all the chest sites, has there been any consideration given to expanding the hours?
Unfortunately, because we have a finite number of individuals who are administering the test, we're pushing them to the limit. And so I think, again, we're going to do what we can do. We have, as you are well aware, we have asked for some assistance from the state with the testing, responding to the demand that is being driven by the residents throughout the state of Florida. We cannot do it alone from the local level. Again, if we have the opportunity to receive at-home testing kits, we want to make them available to our public as soon as we can get them. So this is where we're doing what we can do at the local level. All levels of government have to step up. We're very fortunate that one of the reasons why we're able to do what we're doing here in Orange County with the various testing sites is we were the recipients, the direct recipients of federal funds. We're using primarily federal dollars to be able to afford paying the staff and doing what we're doing at this point. So we look to continue to do it for the foreseeable future, but we need some help. We need some help from our public. We need some help from the state of Florida, and we likely will need additional help from the federal government.
One question was texted in for Alvina Chu. Alvina, the question comes from Ryan Lynch in the Orlando Business Journal. The question reads, Alvina, what kind of settings, if any, have been driving current surges? He says, known in the past, it was said a home setting with varied ages was a factor for prior variants. Are there any trends you are noticing now?
So I don't believe we ever said that. Specifically, home settings were the factor that was driving the pandemic. So what I just stated is that this pandemic continues, and the rise in cases continues to be propelled by persons who are unvaccinated and persons who relaxed or do not, practice good pandemic precautions. And so those remain the most effective layers of how we can decrease the amount of transmission here and help prevent or reduce the possibility of the creation of a variant. And so those places where a lot of people gather together, you don't know their vaccination status, they don't practice pandemic precautions, and when they're crowded together and indoors, so that it's layers of risk that create the situation. Thank you.
Okay, well, thank you all for your patience today. Thank you for coming with relatively short notice. At some point in the near future, we'll come back as soon as we have additional information to share with our public. We will do that.